watching Fox 45 Morning News. All local, all morning.
Over the past few days, there have been numerous tributes to Stuart Scott, the ESPN anchor who died on Sunday morning. Stuart had been battling cancer for 8 years. His was a cancer you don't often hear of, cancer of the appendix. Dr. Paul Celano, head of the Division of Medical Oncology at GBMC, is joining us this morning with more on what is a very rare disease. Good morning.
Good morning.
All right, so how many people are we talking about? Because this is not one of the cancers that you typically hear.
This is an extremely rare cancer. It only really affects about 1,500 Americans every single year. This is in contrast to, say, colon cancer that affects 150,000 colon patients per year. So this huge. Represents about 1% of intestinal cancers.
And so how does this happen? I mean, we've been talking about Stuart Scott and his battle with this over the past several years. How does this happen?
Well, there is no known cause for appendiceal cancer, so so there's no high risk factors. There's no things that we can use to screen patients. And his story is actually fairly typical for appendiceal cancer. He was diagnosed in approximately 2007 because of a appendicitis, and I think a very aware surgeon recognized that he had more than just a routine appendicitis, but had appendiceal cancer as the cause of his appendicitis.
So if you don't necessarily know how you get this, or if there are no signs, I guess, leading up to that, is there a particular group that's more susceptible, or is it anybody?
It really is anybody. It tends to be a younger age group than colon cancer. Colon cancer tends to be people more in their 60s. This disease happens more in the 50s, so it's a younger group. It's equally distributed between men and women, so there's no gender preference on this. So there really aren't any risk factors. It's not a familial disease, so there isn't any familial clues for patients to know that they may be at risk for this.
He fought through this for the past 8 years. Is that typical for somebody to be able to live that long with this? And are there cases, and is it more typical or not, that there could have been a better outcome for him?
Well, the real cures for appendiceal cancer is when they're found coincidentally, such as this, with an appendicitis, and it happens to be at an early stage, so that the surgery can be the cure. Once it is spread, and my understanding from Stuart Scott's situation, it had spread, the treatments really are mainly surgical to try to remove as much cancer as possible, and there are some other therapies that he went through that
it seemed like
can
he
be
did
effective.
some experimental, but he'd exhausted other options maybe.
Right. I mean, there are certainly some effective standard treatments that can be done, and of course he proceeded to more experimental things. He also was very proactive in his care. He was he made a very big push about being fit and keeping good nutrition through his illness, which I think helped him survive as long as he survived.
All right. Well, Dr. Celano, we appreciate you shedding some light on it. Sorry to to see someone like him go.
Yes.
All right. Well, coming up,
you're welcome.
The winter.